Hello, it's Carmen again on CC Drips. Okay, we're doing our first drug, and it is Alteplase. Um, this is a down and dirty drug. It is by category. It is a thrombolytic agent. It will lyse any clot, big or little, uh, young or old. It does its job. Labeled uses. Labeled uses. We all know. Number one, labeled use, stroke. Acute ischemic stroke. Also, central venous catheter clearance, like cath flow. It comes in the little vial, and you can clear out your PICC lines and all that. Pulmonary embolism. It has to be what they call acute massive. If it's only acute small or submassive, it's an off-labeled use. So pulmonary embolism, ST elevation myocardial infarction. So in other words, a clot in the heart. A lot of people call it a STEMI. Now, the off-label uses of Alteplase, frostbite, only if it's acute peripheral arterial occlusion or that's the number one, acute peripheral arterial occlusion, but then frostbite is number two. Significant, and it presents in the first 24 hours of injury, which I didn't know about that, but yeah, it would probably dissolve those clots too. Also, prosthetic valve thrombosis, like if you have an artificial valve, it works with that too. And then, like I said, PE, but submassive. That's an off-label use with a major RV dysfunction. In other words, if it's big enough to have pressure on the right ventricle pumping into the lung, then they might consider it. Now we go on to mechanism of action. Okay, it initiates local fibrinolysis by binding to fibrin in a thrombus or a clot and converts entrapped plasminogen to plasmin. Now, the next one that I usually bring up is where is it metabolized or mediated or whatever. Most of it is very, very short acting. It has a short half-life, and it just goes away in the plasma. But over the next 24 hours after giving TPA or Alteplase, you still have bleeding tendencies. So, and it's mediated by the liver, but it doesn't have to do much because it's almost out of the system in the first 5 or 10 minutes. Okay, so we have reversal agents. Yeah, you gave this TPA and oh my God, it's not, they just had surgery or something. You need to kind of ask them many poignant questions before you give that Alteplase, because there's really no reversal agents. They've done studies on, and here's some white cards, TXA. They thought, oh, this will be good, if we have to reverse the TPA. Studies are showing, no, once you give it, you're pretty much done. Also, we have this other one, EACA, that it's known as. And not a lot of studies have been out on that either, but right now it's kind of a wash. They don't think it really does anything. And there's really no quick fix after you give TPA. They suggest 10 units of cryo, like as soon as you want to get it out of their system, because once you give it, it lyses everything. So you could try 10 units of cryo and FFP and platelets, or if your patient is a Jehovah's Witness or they don't want blood products or something, then they can try the TXA or the EACA on the white cards I just showed you. But it's not going to be a good scenario. Release date. It was released back in February 23rd, 1989. So it's been out for a little bit. It works, but as everyone knows, it has a lot of indications where you can't give it, like after surgery or if you have acute bleeding. I'll go into that a little bit later. Okay, pricing. Pricing is a big one on this one. They say cath flow, the little 2 milligram vial that you clean out your PICC lines, $169 for one dose. But then if you're using it for the heart, like an MI or a stroke, they usually use 90 milligrams, and then you give like 10% the first as a push, and then you drip it in over the next hour. The Activase 50 milligram is $5,126. And if you drop from 100 milligram one, it's over $10,000. So this is one where you kind of have to weigh what is it really needed, and are you thinking about everything, the inclusion exclusion criteria as a stroke association uses. So we go into the contraindications. Contraindications. Yes, active internal bleeding. Don't give it to those people. They wouldn't like it. Stroke within 3 months. Doesn't matter what kind. Intracranial stuff like tumors and AVMs and things that can bleed. They go on to say, let's see, neoplasms like cancer, AVMs, aneurysms, and then severe uncontrolled hypertension. And they say that because if we can control it, like if we get them in, we see that the person is having the stroke, and we can get their blood pressure down, we can control it, less than 185 systolic, and diastolic less than 110. Also, if you have an INR of greater than 1.7, they also say bleeding times over the upper limit of normal. You can give it if it's less than 1.7 INR. Platelet count, if it's less than 100,000, they suggest not to give it. Now we have safety concerns. You have to look at cardiac reperfusion arrhythmias, because whenever that heart muscle gets the circulation back, it does weird things. If you have prolonged CPR, like over 10 minutes, shouldn't give it. All those broken ribs and all that can bleed. It's probably already bleeding, but you can make it worse. And any kind of internal or external bleeding. And that's why they say, get your Foleys and your IVs and all that in, because after you give the TPA, they're just going to be oozing out of every orifice. So we get into drug interactions. Well, as you know, anything that's an anticoagulant. If they've been taking their Plavix and their, it escapes me, all those new ones, it's what they call category C risk factor. And then herbs, like if they're taking homeopathic agents, vitamins and stuff like that, you have to look out for alfalfa, anise, ANISE, and bilberry, and then salicylates, like aspirin. That's also a C. Oh, the herbs and everything, they make that a category D because it does affect your clotting ability. So I think that is all with that one. That's a basics of Alteplase. And like I said on the tutorial, please like my video or subscribe, and then you'll see the new videos that I'm coming out with each week. I hope you like it. See you next time. Bye.